Crush now?
Check to see who she wants to come up.
Hello and welcome. My name is Michelle Palmer, and today I want to inform you on why is it important to have cancer screening done, the recommendations of when to do them, and the statistics on survival rates. As a medical oncology nurse, I see cancer diagnosis at all stages. I have many of my patients that tell me they wish their cancer was found at an early stage because they feel as though they were handed a death sentence. Every day someone dies from cancer, and most of them were diagnosed at a late stage, usually being stage 3 or 4. So why should you have regular screening done? According to the website cancer.gov, cancer diagnosis is on the rise in the United States. Some people think it only affects the elderly, but the truth is it affects all ages from infant to 90 years old. Sometimes it can be diagnosed in precancer stages, where surgery alone is the cure. There are two groups that provide cancer screening guidelines. According to the website cancer.net, these two groups are the American Cancer Society and the U.S. Preventive Services Task Force. Some screenings for certain types of cancers are still in clinical trial, but there are some common types that regular screening is recommended. From the website, oncologists approved cancer information from the American Society of Clinical Oncology and the book Complete Guide to Colorectal Cancer. Colorectal cancer being one of the common cancers, screening starts at the age of 50. Unless you have a first-degree relative that has been diagnosed with this cancer, then the screening begins 10 years younger than the age he or she was when they were diagnosed. A colonoscopy and sigmoidoscopy, where a surgeon looks at your colon with a lighted scope, should be done every 5 to 10 years. A fecal occult blood test should be done yearly, and a double contrast barium enema should be done every 5 years. None of these things sound fun, but the payoff is worth it. In addition to the other references cited, the book Prostate Cancer states that prostate cancer is also common. Screening is recommended yearly with a blood test level that checks the PSA, which is prostate-specific antigen, and a digital exam that should be done yearly also. The next common cancer I want to discuss is cervical cancer. Screening for this cancer should be done 3 years after becoming sexually active or at the age of 21, whichever one comes first. These screenings consist of pelvic exams with visual exam of the cervix, recommended to be done yearly, and a Pap test, which is the collection of cervical cells, should be done every 1 to 3 years. Breast cancer, as we all know, is very common. Having a mammogram every year starting at the age of 40, as well as the clinical breast exams are recommended. Skin cancer is also a very common, but usually we don't hear about that very much. Checking your skin periodically should be done, and if you are concerned about an area, then have a clinical skin test done. Remember, all of these recommended ages are just that, recommended. If you are having problems or concerns, don't wait till you reach that age to talk to your physician. It may be too late. Detecting cancer early has a higher survival rate. I want to go over some of the statistics based on a 5-year survival rate according to the book Cancer Free and the website cancer.gov. Colorectal is the third most commonly newly diagnosed and the third most common cause of cancer death among both men and women. When cancer is diagnosed at stage 0, where you only find the cancer in the lining of the colon or rectum are affected, that survival rate is 100%. Unfortunately, if it is found at stage 4, when it has spread to other organs, usually the liver, lungs, and ovaries, that rate drops to less than 10%. With cervical cancer, there is an estimated 12,340 women that will be diagnosed this year, and out of those people, 4,030 will die. When cervical cancer is diagnosed at stage 0, where the cancer cells have replaced normal cells on the outer layer of the cervix, the survival rate is 100%. If it is diagnosed at stage 4, where it has spread to the bladder, rectum, and lungs, that rate drops to 15%. Approximately 1 out of 10 men will develop prostate cancer by the age of 75. It is the cause of more than 41,000 deaths annually, if not caught early. At stage 1, where there is no palpable abnormalities of the prostate, the survival rate is greater than 90%. But at stage 4, where it has spread to lymph nodes, bones, and other organs, their survival rate is 21%. With breast cancer, there is an estimated 234,580 new cases in the United States this year, with 2,240 being males. Of these numbers, 39,620 females and 410 males will not survive. When breast cancer is diagnosed at stage 0, few layers of cells are affected. The survival rate is greater than 95%. If diagnosed at stage 4, where it has spread to other organs like bones, liver, lungs, and brain, that rate drops to 10%. And now for skin cancer. There were more than 2 million cases diagnosed last year, and less than 1,000 have died. Skin cancer at stage 0, where cells are precancerous, that is a 100% survival rate. But at stage 4, the disease has spread to lymph nodes and other organs. That rate is less than 10%. Today I told you why it's important to have your screening done, when to do them, and the statistics on survival rates. As no one likes the C word, cancer diagnosis is on the rise in the United States. But through proper screening for early detection, the survival rate is also on the rise. So if you are at proper age, it is time to talk to your doctor and start cancer screening. I know I did. I would much rather find out at an early stage and have a better chance of survival than not. Thank you for your time and attention.